Initially, I was planning to go in person, but due to unforeseen circumstances in the world, we had to switch to the virtual format. Knowing that this program was something that I really wanted to participate in, I still chose to attend virtually from the United States, even though everything would be operating on time in Switzerland. So in preparation and to ensure I could maximize my full participation, I found myself going to bed at about 5 or 6 p.m. Eastern Standard Time from Boston. And I would wake up at about 1:30 a.m. in the morning in preparation to start presentations and like group chats at 8 a.m. in Switzerland time. So I was ready at 2 a.m. on my time in the middle of the night to be ready for things happening at 8 a.m. in Switzerland. I just knew it was something that I wanted to do, so I was driven to just go to bed a little bit earlier and then just be up in the middle of the night.
I followed the course Working Together as Professionals in Health and Social Care in different countries. And that was about different professionals, how they work together in different places. And like hospitals, revalidation clinics, and emergency nurse also. So it were different backgrounds, and then also the different professions, how they work together, what's their focus.
I think what motivated me more was to know about the Western social work, basically, because I come from a social work background, and being from India, I know that what are the different issues that we are facing and how we are actually coping up. But it is also very important as the social work profession has emerged from the West itself. So I think it's very much important to know that what is the West doing right now? How are they coping up with the problems? Because problems and issues are never ending. And I obviously learned a lot that how they are coping, because the friends I made there, the different conversations that took place, I think that was very helpful for me to understand.
A typical day in the online version of the winter school was that we started in the morning on our own to watch a video about like a hospital or something, an institution. And then at, for example, 10 o'clock, we meet with a small group to discuss what we saw and whereabout we had questions for. And then, like 11 o'clock or something, we go together in the big group, and then each small group had to ask questions that we prepared to the professionals about from that institution. Then, and in the afternoon, it was also like that, or we had to work for our final task for the end of the week.
If I had to pick a favorite part of winter school, I think it would be the symposium presentations. They were all, I think, within 30 minutes, but I got to hear from so many different professionals around the world, hear what they're doing, hear what their research is, hear what they're engaged in. That was the diversity that I was seeking, especially in applying to go to winter school. I got that from that day, and I felt so fulfilled in seeing people from diverse backgrounds and diverse countries presenting on so many topics I had never thought of.
If this opportunity is given to any of my colleagues, basically, or my friends, basically, I would definitely recommend them to take up this course. It will be much more better if offline or on-site mode is available. But even if it is not available, I would recommend to go on for a online winter school, because the learnings and knowledge that I have gained, I would definitely encourage that particular colleague of mine to definitely have that. We could all freely talk to each other there was no one to judge us, or there was nothing right or wrong in our discussion. And the way like the discussion took place, the way we presented the last day the pitch was presented, and how we involved in it, I think I just loved it.